We are at the Planetree International Conference of Patient-Centered Care, and we just played a game called Hello.
Hello is a conversation game about living and dying and what matters most to each of us.
The experience, I would say, is probably the best part of Planetree Conference so far. I'm not expecting it to get a whole lot better than this, actually, because it was really amazing.
It brought a table of about 10 of us together. We didn't know each other prior to the game, but what the game's purpose is to facilitate difficult conversations in an easy way.
I was laughing when the person came around at lunch and said, "Hey, come play a game." And I said, "Okay, are there prizes? Because I'm out to win." And I actually won at my table. So it was fun. But beyond that, it was more about, hey, these are really important questions. Have I asked myself them before?
They were incredibly thought-provoking. A lot of it related to end-of-life care or some of your wishes that maybe some younger folks haven't put much thought into. And what would happen is you'd answer the question, and then immediately you start to think about, why did I answer it that way? Or, what would happen if?
Who haven't you talked with in more than 6 months that you'd want to talk with before you died?
It makes you more reflective on what you want.
I don't know if there was a favorite question. Each and every one of them made you think.
Some of the things that you would never think about with an end-of-life discussion or advanced care planning is what type of music do you want to hear if you're in the hospital?
I put some AC/DC, Bon Jovi, my Sweet Home Alabama. I just kind of like that kind of music. So why would I listen to anything different?
So some of the answers are actually, it's funny and you laugh. It's not a depressing conversation. You start to talk about things that maybe you haven't put a lot of time or effort into, and you start to see other people's views where everybody's really an individual, and you can't assume anyone will know your wishes because you probably don't even know your own yet. It wasn't a morbid game by any means. It was actually a lot of fun, and you're being very honest and sincere with each other.
I just think it's amazing because I feel like I made some really good friends just within the half-hour, 45-minute session, and people that I've never seen before. Once we get into the game, it's almost like we always knew each other. We were very comfortable.
I appreciate things that provide a kind of instant intimacy, and that's what happened with this. By the end, I think we were about all on each other's Christmas card list.
I think for healthcare professionals, it really is a great way to get past a very difficult topic, which is life and death. Learning how to recognize that and deal with your own emotions about it really is about helping the patients and their families go through it as well.
It's really interesting for us to see how people use the game and then what actually results from it. People's confidence in starting conversations with patients about their values, goals of care kinds of conversations. Their confidence in those conversations goes up, and actually goes up the more they play the game. The other thing we hear is that people feel like they are able to act as a team more effectively having played the game because they get to know each other, they understand each other, they get to be a little vulnerable in front of each other. And I think that really helps to build teamwork, which is so important in healthcare, where people really need to act together in order to provide the kind of care that they really believe in.